how has the COVID-19 pandemic affected your mental health personally?
Me personally.
Are you okay?
But when something like a pandemic hits, people start to realize how little in life we really have control over.
Yeah.
Worsening conditions, not just health conditions, mental health conditions, domestic conditions, homeless children, your immigration status, all of those things were affected by the pandemic in one way, shape, or form. So, hello, Globies. Welcome to World Health Investigation. My name is Jocelyn.
I'm Edna.
And I'm Loza.
We're three young global health professionals and your hosts for the World Health Investigation podcast.
Also known as the WHI, and we'll be discussing all things global health and unpacking the most controversial health issues,
as well as promoting new wave global health development and equity.
So, ladies, what's the key global health today?
What's going on today?
Today is going to be a little personal, guys. Remember when I asked, are you okay mentally?
Mentally?
Oh, you really meant that?
I meant that. Today the kids are not all right, and we're going to discuss.
What do you mean by discuss this whole? You're getting into our personal space here, Lord. I'm not liking it.
I am. Well, you guys said we're going to spill the tea. You get?
Not on me.
On you.
Not my own tea. I said global health tea, not my personal tea.
Global health involves you. Are you not in the world?
Oh,
yeah.
You're not wrong.
Wow, she really came for my neck today.
Every day. So, today, we are the youth, right?
Mm-hmm.
And today we're going to be talking about the impact of COVID-19 and all that it came with, all the gifts it gave us, and its impact on the youth's mental health. So that's why y'all gonna be spilling the tea, because y'all young people. So,
okay.
Well, I'm gonna start with like a little case study to ease us in there. I'm not gonna put you on the spot yet. Just yet. So, you guys remember in 2020 when I'm gonna talk about the UK, when the government said and the university said, come back to uni, we're back to normal, Corona is over. Easy lemon squeezy, fun times. And students came in, and then there was lockdowns. Students were getting COVID at high levels. That's kind of the case study. So if people don't know about this particular situation, in 2020, there were warnings from public health officials saying that students should not be returning back to school. But universities, and there was pressure from higher management to actually continue classes. They said in-person classes would be back, and there was a lot of encouragement for students to come back. Once students arrived, there was spikes in COVID cases. There was complaints from people that were living in towns where there were big universities, because then they were also getting COVID as a result. And so students' unions were saying, we should shut down. But there was pressure because most universities didn't want to basically have a financial cost, because if students were studying at home, they would ask for reductions in their tuitions, and they were not having that. So in the end, what happened was when students got COVID, they'd be forced to isolate in their accommodation with not a lot of support system. I know personal examples of students where they were told to isolate, but then they could not buy food because it would be on the weekend and the food delivery service would not be there. And there was like no checks, no systems to actually help them. So they'll just be there, maybe relying on a kind flatmate that doesn't have COVID. At some point, some accommodations were barricaded with metal fencing, so students couldn't leave. There was loads of protests. So it just all erupted. So clearly that had a lot of mental health issues. There were instances of suicide. Like there was a couple, like at the University of Manchester, for example, where there was a lot of complaints that students did not have wellness checks, where, there were a lot of first-year students that were away from their families for the first time, and they were thrown into this. So that's kind of that was the situation. So now I know I did some of my uni during the pandemic. I know, Jocelyn, you did your entire master's during the pandemic. And half of your degree was in the pandemic. So, we've seen a little bit of this. So no, you guys tell me about like your experience and how your mental health has been during, lockdowns and the era of COVID and studying and being a young person?
I don't know, Miss Edna, do you want to go first?
Now you can take it.
You guys are rushing to go first, aren't you?
You got this. See the way she didn't hesitate to be like, Edna,
go.
This topic is a little personal.
Yeah.
How did what was your question, Loza?
Do not waste time. Get into it, yeah.
I eased you in. I said, how has the COVID-19 pandemic affected your mental health personally?
Me personally.
Are you okay?
Yeah, I'm kidding. So I remember when I first heard, I start isolate. I was like, 2 weeks, easy. I get 2 weeks off school.
Remember that.
I can relax.
Exams are cancelled.
I don't have to go all the way to my lectures. I can just attend my lectures on Zoom with half my pop-up and the other one, nothing. So it was amazing, And then eventually, this kept on being prolonged. And I was like, 2 weeks turned into 3 extra weeks, turned into months. And then it turned out we're in 2 years, almost 3 years in. I personally, the moment I clocked that I'm going to do my master's in my room, I don't know, that hit me hard. That I'm going to do the master's that I applied for, and I was so excited to do, and I was so excited to travel to South Africa and do all the projects that they had in my room. In my room. Yeah, it really, I feel like it kind of triggered some mental health issues that I never thought I had. I'm not gonna lie. I think before I was like mentally okay. I mean, most of the time I would say, I was mentally okay, but I think during the pandemic I had a lot of time to think. I had so much time, even though I had a lot of work, I still would spend so much time alone that I had so much time to think and reflect, which was usually good because then you get to think and reflect, right? But then too much self-isolation is not good because then I started developing like some toxic thought patterns, like overthinking literally every single thing. My work, my friendships, my education, my career, my family, everything was just, I had so much time to think about everything. And it just kind of made me, I don't know, depressed. A little depressed for a bit, but I mean, eventually I should have sought therapy, and I think I should.
That's what we recommend.
Yeah. But I kind of developed like some journaling habits. I started journaling, even like just, especially because I started living alone as well, like speaking to myself, being as interactive with myself as possible, and journaling, and also like staying busy, like going to the gym, doing dance. Like dance has been my therapy. Like I was running some dance therapy sessions during the pandemic. So it was not only satisfying for people, but for me as well. It was very rewarding. So, that's it. That's all your
journey.
Yeah, it's a whole journey.
A journey and a half, man.
Yeah.
Some relatable things in there, I can't lie.
Definitely. No, I can resonate with a lot of that.
Yeah.
Yeah, for me as well, it was the same thing of like, when we're just told at first that, it's just 2 weeks lockdown, and you're like, that's fine. 2 weeks, I could deserve a little 2 weeks break. In fact, I'm thinking, I usually don't like this whole cycle of business in this world. Like now we have 2 weeks where we kind of all have to slow down. So I was like, great.
That's so true. I remember you saying that, I'm not made for labor. I'm not made for
Did I say that?
Yeah.
Damn, maybe I was watching too many of those TikToks.
Yeah.
Maybe I was too much on that
I
way.
missed that era.
So, but I again, so I remember, I think I started like pretty early on the whole, like, okay, I adapted to like doing my workouts at home because I used to go to the gym, but I was like, hey, I can do my workouts at home. I was watching all the videos, all these like workouts that didn't require like equipment. I was like, great. Journaling as well. I started journaling at the beginning of like lockdown because now I was like, I have time to journal and be in my thoughts, be in my feelings, like let's get into it. So that was great. But then that just got old. Then the whole back and forth with the like coming out of lockdown, measures being eased, and then going back into lockdown. That's what got me in the end, because it was like there's so much I was looking forward to doing now. I'm like, okay, yes, we had time to slow down, but now I'm ready to get back into the world and like see my friends and go places, do things, da, 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 da. But then the lockdowns kept on coming, and yeah, that was what really I think demotivated me towards the end. And I had the same point of realization, which also of like, I'm just gonna do the rest of my degree in this room. My whole degree.
I don't know why it hits hard.
It hits hard. It hits very hard. Like literally now what I do is I wake up, I walk to my desk, and then I'm back to my bed. I'm like, that is my new life.
That's my whole lifestyle.
That's my whole lifestyle now.
Oh, y'all.
Me, I enjoy a busy lifestyle, going to school every day, going to uni every day, doing different things. I had to stay in my room.
Just everything
counts in my room. Do everything in my room.
Yeah, exactly. So it was that realization, and that's when I was like, yes, most times I'm usually like, I like to be chill. I like, I don't like to be too busy. But then that's when I started to realize like, okay, I don't realize these things that like help in terms of keeping me motivated to like do things like, yes, being able to say, okay, I have my lecture at this time and that time, then I'm gonna go have a coffee with this person, then I'm gonna have to go to like a society or club thing in the evening, and then I go back home. Like that kind of like routine or structure, like I actually started to miss. And it was hard to, it was just not possible to have that. And I just lost motivation to like find creative ways to do things virtually, and like Zoom got tiring for me. So I just felt like I was just in a lull of just like, I just have to continue to exist and survive until I don't know when.
I feel that. Yep. You just sit
until
there
I
like,
don't know when.
I hope it ends soon.
I just hope it ends soon.
Nothing left in me now.
Exactly. I was like, I have nothing left in me. I have nothing left in me. So, I mean, what helped was like, at least I'm like back home here with my family, and I get to be with them. I have, people to speak to. There's some nice woods here, so I take my nice walks there. And also for me, the experience has been like starting work, like a full-time job, like in a pandemic as well, which has, pros and cons. Yes, it's nice to work from home because the whole commute you can avoid and da-da-da. But it's like, I don't really get to interact with many people from my workplace. It's just, I'm just at home by myself working, and it's, weird. That's my story.
Very, very relatable stuff. Well, I was gonna sneak out of this, but I think
you're not running. You're not going anywhere.
Why?
Kill your team.
My podcast, and I'm not gonna say nothing. Okay, well, me. Yeah. So yeah, initial lockdown. They said 2 weeks. I didn't believe them. I said, there's no way this virus is gonna vanish off the planet of the earth in 2 weeks. But I kind of even wanted the lockdown to be a little long because this was like exam season for me. So I said, I wanted, I had like, my ideal. I was like, okay, we're going to have a nice lockdown until the end of May. And then by then we should be okay. The curve should be flat.
When you were leaving, so I was like, you're not going to come back.
I remember because I left England. I was like, I'm not going to be locked down here. Bye. I went to Switzerland and I was like, I'm going to do my exams from home. This is fat. You know what? This is great. I'm about to get my first easy peasy. And I thought it would be calm. And then I said by June, everything will be fine. I'll be in the UK. I'll be having the best summer of my life. And then, the curve will be flat and it won't go back up. I said, let me not think too much about that. Like, let me not epidemiology go away. I said, the curve will be flat. I don't care. June came. I was still in Geneva. And then July came. Things were open-ish. But the cases were everywhere. And by the end of summer, there was talks of another lockdown again. And so for me, like uni and lockdown was fine because I only had it in exam season. But then after, my plan was to do a gap year, to travel, to get some work experience. I wanted to work in global health, so I wanted to get field experience. All those dreams were dashed. Going, who is traveling in this Panasonic? Not I. So that, autumn comes, that is when things got crazy, I think, globally. There was lockdowns everywhere. And I was in my house trying to, replan my gap year because everything was gone. So now I'm sitting in my home like, okay, so I got an internship. Like you said, Edna, like not meeting your coworkers. I did that entire internship and I met no one. I don't know anybody in that internship. It was just sometimes we'd see each other on Zoom. That was it. So I did the internship, that ended, and now I'm sitting at home again. Like this pandemic is still going. At some point I got really obsessive. So as you said, like you have a lot of time to think. I also had terrible toxic patterns of thoughts that even now I'm like working on undoing. I have not recovered. Like I'm still, I've come out of this situation different. But on top of that, I got so obsessive over the pandemic and the curves. Every morning, the first thing I would do, I was an epidemiologist.
My goodness.
Every morning, the first thing I would do is I would look at the curve in Switzerland, the UK, Ethiopia, like my country, and I'll be comparing them. I'd be trying to track, like, okay, is it going up? What are the deaths looking like? And then I'd look at the government measures, like, what are they doing? Are they more likely, like, to ease it? I was also kind of in a long distance relationship, so I was trying to see him. So I'm trying to figure out, like, and our countries banned each other, like no one was allowed to go anywhere.
Yeah.
So I was sitting there every morning, like obsessively researching. At some point, like I really got depressed. I was like, oh, it's not changing. 1 month passes, the second one, the third, the fourth. And I said, okay, I'm just gonna survive. Then that's when I just decided, okay, I'm just gonna go with this flow. And eventually it'll be over, right? And I think this year's better. I think measures are a bit more consistent, or maybe I think we learned from last year's chaos. And I think a lot of it also, like having a little bit of like a support system with friends helped me. So we couldn't really meet inside, but we'd go to the lake in the freezing cold. I really appreciated that, to be honest. That kept my sanity, like the only thing. But we'd be going to the lake because that's the only thing we could do. We can meet outside. We'd be doing that like in January and February. And that's kind of what helped me, I guess, just having a little bit of like people.
I wonder about like do you feel like you've had any like physical, has the pandemic had any physical effect on you at all?
Physical effects? I feel like it's aged me. I look at my picture now, or like I look at my face now, my picture from 2020, and I look like I've been through something. Like,
I feel like it was my skin. My skin feeling like my skin. Like the lockdown weight.
But what's funny for me though, it's I did think as well, like, okay, like at some point I stopped the exercising and all these different things, like I just could not do it. But like I still like my weight, I feel has still like, I don't know, it hasn't like gone up as much as I expected, given that I just sit down at my desk all the time. Like I feel like it's more like I feel like I'm wasting. I'm wasting. Right, weight.
That's how I feel.
You know what I mean?
My weight hasn't increased, to be honest, but like all the work I did at the gym is vanished. God, I'm so weak now. My skin, like you said, just last year my skin was bad. I had to go to a dermatologist because my face was falling apart, and I couldn't do anything either.
We started to, I'm like, is this normal? Like my whole life I've never felt like this, but I'm feeling even the physical health effect. Not just mental health, but I could see it becoming physical. Like I gained weight. I knew I gained weight. So I started going to the gym, doing this left and right, but also because I knew that like I understand the health impacts of gymming on your skin. So I was like, what's happening? Like, why am I getting these new weird pimples? Like, what's going on? And I was like, it's a pandemic.
It's a pandemic. Guys, and I think that's the important thing I was gonna say. It's to note that like it's a collective trauma we're going through, and like it's okay, like if you're feeling off, that's kind of very normal. If you're like, it is, anybody would feel like they would feel off in the situation, because we are literally going through a whole virus that's just killing people. But
I was just gonna say, I thought it was interesting, or like, obviously sad to hear that you guys were like, you were actually like feeling depressed and stuff like that. Because the thing for me was also like, that was what was hard to point out. It was like, it's a pandemic, so we're all going through something, definitely.
Yes.
Right? Yes. So to me, in my mind, I was like, we're all off. It's a pandemic and stuff like that. But I would never have gone so far as like, I'm like depressed. You know what I mean? Because I'm like, is this from the pandemic? Is this from just other life things? Is this from seasonal depression or something like that in the winters? Like, I was just like, there's no way for me to know. It's just
True.
things are not okay.
Yeah, they all teamed up last year too.
Yeah.
For me, the way I knew, right? Like, I was in denial at first, but it became very, very clear. Like, the number of times I would cry per week, it was documentable.
I started tracking it. I did.
Literally was like,
I would cross it in a calendar. I said, today I had a breakdown.
I had a breakdown. Like, it's a week. Like a, like a normal thing, like my daily tears routine,
Yeah.
That was
Here we go again.
Here we go again.
Yeah.
There was a time when I made one whole week without crying, and I was like, we're doing amazing.
Wow. Oh, Jocelyn, you literally sounded like me. That was me. I was like, well, this has been a good week. I think I cried only once. And that's when I sat there, I said, oh, I'm not a crier either. What's going on?
Every little thing would just bug me. Every single thing, from the smallest things to the biggest things.
Yeah.
There was a problem everywhere, and I couldn't fix anything. I couldn't fix. I like being in control. I like being in control of my life. But it was the one thing I had no control over, and it was my life.
Yeah, it's also that like loss of control. You don't know what's coming next.
Yeah.
That adds to the anxiety as well.
On top of that, the job hunt. Forgot about job.
Yep.
Graduating. I had just finished my undergrad, started my master's, doing dissertation, caught the corona, moved out twice. Everything was just happening in relation to the pandemic.
Right.
Yeah.
So it was not.
No. Yeah. And I think everything that like we've touched upon is sort of kind of it goes into the structure of the different factors that affect the mental health. So based on researches, like the first thing is social isolation. So just doing uni from your room, desk to laptop, that's it, nothing else. That has impacts. Loss of structure. So, as you said, that like having that little schedule, that routine, and having that taken away.
Yeah.
I know you're there trying to make your own, but like, what routine could you even make? You're in your house.
Yeah.
I remember learning how to do this place. Losa, do you remember we started?
Yeah. I was so close. And then I gave up.
We started all types of challenges.
I did. I was trying to learn the splits. I was trying to do anything, a handstand, like meet some kind of goal to give you some kind of like endorphins. Because
achievement. It's the lack of achievement.
Exactly. And then also like the big thing is disrupted, like for young people especially, disrupted like transitions in life. So from high school to university, or from university to getting jobs. Like again, when I graduated 2020, people were losing their jobs, let alone getting hired. Where are you gonna go?
Find one.
To find one where?
Yeah.
So all of that entirely, like no one was prepared for. And so in the end, it's bound to affect you. But I guess to wrap it up, do you guys have like any advice to give people? Because I mean, we're the ones in it. We are not mental health professionals.
We're not
mental health professionals
at all. But anything that's helped you or that's worked for you?
I mean, I can start us off. For me, it was definitely just being able to be like kinder to myself, much more patient, definitely giving myself more grace of like, you do not have the same mechanisms you had before in terms of like the support system, being able to just go places with your friends and it'd be like not a hassle. It was like, for example, coming to visit in the UK, it was like, okay, I have to go get my COVID test. I have to go do that. Like there's certain things that just started requiring more and more effort. And I just sort of had to recognize that and be like, listen, don't be too stressed if you think like everything is so much harder now and you just feel like, there's so many obstacles in your way to just get things done. That is just normal, and just give myself the grace of like, everything may not work out the way you want it to work out, but there's a huge part of that is now out of your control. And so I think like Jocelyn, you were saying before, like, we tend to like to be in control of certain things in our lives. But when something like a pandemic hits, people start to realize how little in life we really have control over.
Yeah.
Like it's usually that way in the end, but we like to have control of the small things. But a lot of the times we have very little control, and it's to just, be able to accept that and give yourself the grace of like, what, you're trying your best. You're trying your best in the pandemic.
Yeah.
That's beautiful. I would say that's beautiful. Beautiful. Before I give any advice, my thoughts and prayers go to people that have actually lost anyone during the pandemic, because I can't imagine what it would be like if I had lost any of my close ones.
Yeah.
It must be devastating in this time. People that had previous mental health experiences, that had previous mental health disorders, pre-existing ones that got worsened, increased levels of domestic violence, worsening conditions, not just health conditions, mental health conditions, domestic conditions, homeless children, your immigration status, all of those things were affected by the pandemic in one way, shape, or form. But we're here. We're in 2022. We're existing. Not even if you haven't achieved anything, if you even, because I can understand that, like during the pandemic, you would almost feel like you lack that sense of achievement. You see people achieving stuff, but you'd feel like, okay, maybe I haven't achieved stuff. You being here already is an achievement, and you should simply be thankful for that. And also be kind to yourself. I say it a lot, and I'm learning how to do that. No one is time to rest. And adopt new patterns, because if whatever you were doing before wasn't working, then clearly it's not going to keep on working. So find new ways to reconnect with yourself. As I said before, journaling is really good. Staying in touch with friends and family, like call your friends, call your family. Stay in touch with people that you love, and just look out for each other.
You're right, because I think we spoke from the perspective of students, because that's what we are, but like the pandemic affected people's mental health from so many different angles, and there's so many things that got disrupted that obviously are going to affect your mental health. So definitely, I think my advice, I probably should take it, is like reaching out for help. Seeking help is not really weakness. Don't be afraid to do that. Acknowledge your feelings. I think a lot of times can be in denial, like you'll be feeling off, you'll be like, I'm fine. But I think the first step is to acknowledge, like, okay, you're not feeling okay. And try to seek help. That may be therapy, it could be through friends, but like anything that you have access to. So that is what I say.
I mean, just to bring it all together, I think also just linking what you Loz are just saying and what Jocelyn said, like, don't also let the whole idea of, we know, like, we don't want to obviously ignore the fact that there's people who actually lost people to COVID, and people who couldn't even see their families to say goodbye, people who haven't seen their families in like years because they couldn't travel to see them and all these different things. But it's also just like Loz is saying, like, recognize everyone's experiences, like your experience is also just as valid.
It's valid,
like, you don't have to have like completely been devastated, lost your house and your job and be in all the streets to feel as if, to admit that, like, no, I'm depressed, no, I'm very anxious, no, I'm not okay, no, I need help. It doesn't have to be the most extreme case for you to admit that you need help.
No, I think that's that was awesome. I think that is a good note to end on, huh?
This is very wholesome.
It was awesome, the personal one. Maybe we'll be okay. But
maybe we'll be okay.
But no, that is a good note to wrap up on. And thank you all for listening to this episode of the World Health Investigation Podcast. I'm Loza.
I'm Edna.
And I'm Jocelyn.
And tune in next week for our next episode on World Health Investigation Podcast.
And final thing, make sure you follow us on our socials. Instagram, WHI_podcast, Twitter, WHI_podcast, Facebook, World Health Investigation, LinkedIn, World Health Investigation, and subscribe to our YouTube channel.
Yep.
And find us on Spotify and Apple Podcasts.
Yes, Jocelyn with the plugs. We're gonna get
plug that in. We must. But yes, I think that's all. See you all next week.